Together we create possible.
Hello and welcome to this Young Epilepsy podcast. These podcasts aim to discuss really hot topics for children, families of young people with epilepsy, and also for healthcare professionals. My name is Kirsten McHale. I am the epilepsy nurse consultant and head of health at Young Epilepsy, and I'm really excited to be hosting these podcasts and spending time with you guys today. So before we jump into our next really exciting podcast, I'd like to thank our sponsors for today. For over 25 years, Nutricia Ketogenics have been dedicated to supporting patients with drug-resistant epilepsy. Their extensive range of ketogenic medical food is designed to simplify the ketogenic diet for both adults and children living with epilepsy and supporting their families. For people who have refractory epilepsy, the ketogenic diet can offer a promising path forward. Our supporters do not influence the Young Epilepsy podcast. The creation of topics, guests that we have, and questions are led by Young Epilepsy and our community. Hello and welcome to our podcast on mental health and well-being. And I am really, really pleased to introduce Sophie, who is our clinical psychologist from KCL. Did I get that right?
Yeah, you got it right.
I'm going to hand over to you to talk about what you do, and I'm going to just pose some questions to you along the way.
Sure.
But if you could just introduce yourself to our audience and our listeners, tell us a little bit about yourself, add in some fun facts if you want to, and then we can start the podcast.
Sure. So I am a clinical psychologist, as you say. I'm also a researcher. So my technical title is Senior Lecturer in Clinical Psychology at KCL, and I've been there since January 2023. Before that, I was at the Institute of Child Health, working on research projects at UCL and Great Ormond Street. And so I guess I'm generally interested in mental health in children and young people, but I have a specific interest in thinking about integrated mental health in physical healthcare services. And I've been involved in a big study looking at children with epilepsy specifically. So that's one of my areas of work. In terms of interesting facts about myself, that is a tough one. I think I like to watch lots of television, which is probably not the best hobby to talk about. I also have a little dog that I take on lots of walks. Other than that, seeing my friends and enjoying what London life has to offer.
Oh, amazing. Thank you. We all like a little bit of trash TV, Sophie, so, no judgment.
In secret, usually, not on a podcast.
Thank you so much for joining me, and I really do appreciate your time today. This is a topic I think we don't talk about enough. Mm-hmm. I think it's a topic that we fail on hugely, but I want to unpack that a little bit with you and get your views on a few questions that are posed to us a lot of the time. Mm-hmm. So we understand that children and young people with epilepsy are significantly at higher risk of facing mental health challenges. Yeah. And we understand it's about 4 times higher. Mm-hmm. Why do you think that is?
So there's lots of different reasons, and it's going to be different for every young person with epilepsy. And not all young people with epilepsy do have mental health challenges. Broadly, we know that children with chronic illness do have higher rates of mental health difficulties. We think that's because, or research has shown that's because they face lots of challenges in their lives that maybe other young people don't. So children with epilepsy specifically obviously might face seizures regularly, which can be very frightening, worrying for them and for their family. They have lots of hospital visits that can disrupt their schooling and times that are really important for young people. So they might be spending more time away from their friends and from school, which can impact on their mood and worries. But for children with epilepsy specifically, we know that those rates are higher than for children with other chronic illnesses. And we think that that's likely because there might be some shared pathways that put somebody at risk of having both a mental health difficulty and seizures. There's also kind of side effects of medications in epilepsy specifically that might impact on mood and behaviour.
I think medication is a big question that's often asked to me in my clinics. I think medication probably is the top one. And a lot of questions that are always posed to me is, can we get psychological support? At diagnosis, should we be giving psychological support?
Yeah.
I don't know from where you sit, but where I sit, I go, do you know what? I'd love to be able to refer, and we should be able to refer directly to psychology for support for the whole family, but we fail because there isn't the resources, I guess.
Yeah.
I do a lot of pushbacks to schools, and I say, there are counselling services at school. Mm-hmm. Is that what we should be doing, Sophie? Or why are there such constraints around finances?
Yeah. I mean, I guess you're right. Ideally, we'd like to be able to refer into integrated physical and mental health services, and that's really what a lot of our research in our team has looked at. I think, we all know that the NHS does have a limited budget, and I guess it's been difficult because there hasn't necessarily been the evidence that these treatments for mental health difficulties do work and are effective for children and young people with epilepsy, which is the reason we did our own research. I think that we need to build the evidence to show how effective integrated physical and mental health services can be, and use that to leverage funding for more services in epilepsy.
Because it's talked about a lot, isn't it? Epilepsy 12, we talk about it a lot as to what we should be doing, where the research is coming from. Talk to me about your project. Talk to me about MICE.
Sure. So MICE stands for the Mental Health Intervention for Children with Epilepsy, and that was a trial. The chief investigators were Professor Helen Cross and Professor Ross Shafran, and so we looked at training epilepsy nurses and other professionals from within epilepsy clinics, also assistant psychologists who are graduate psychologists but who aren't trained in kind of clinical intervention. We trained them to deliver a treatment which was really a standardised treatment for common mental health problems in children and young people. So a treatment for anxiety, low mood, behavioural difficulties. We had a trial where we offered half of the young people in the trial the MICE intervention, and half received their usual care. And what we found was the children who had that integrated mental health intervention did much better. So they had fewer symptoms of emotional behavioural difficulties than the children who received usual care for their mental health difficulties. So we were really pleased, and we published that research just this year.
Oh, that's incredible. Yeah. And what do you plan for the future with MICE? Is there a future plan?
We hope so. So I think, we were really pleased by those encouraging results, and we did some interviews with families and with clinicians who also were really positive about that integrated intervention. I suppose now the plan would be for it to be offered widely, now that we know it works, to be able to offer it to epilepsy services, so that any child or young person with epilepsy can access support for their mental health needs when they need it.
What would that look like?
So
that's the big question. I think everybody wants to know. What does that look like?
I think it looks differently in different sites. So I think, for some sites in MICE, we had epilepsy nurses who were delivering that intervention. For some, it was assistant psychologists. We're really excited that NHS England are piloting MICE in some areas. So they are joining it up with another, what was a study intervention called PAVES, which is basically screening for mental health difficulties for all children and young people in epilepsy clinics, and then offering kind of a stepped care approach to treating those difficulties. So for some young people who have maybe some signs of emotional behavioural difficulties, but maybe don't meet criteria for mental health disorder, they might be offered, say, group interventions, learning about the relationship between epilepsy and mental health. And for those who have more difficulties, they might then be offered MICE. So we've been able to train some sites across England now to deliver that as part of usual care, and that's going to be evaluated. And hopefully, if the results of those pilots are positive, then that will give, again, leverage for funding, so that we can roll it out across the country.
That would be incredible, because I think The pushback I would expect to
Yes,
come
yeah.
would be things along the lines of your epilepsy nurses saying, we don't have capacity,
Yeah.
we don't, it's
Yeah.
another time constraint added onto our already hugely time
Yes.
constraint world of
Yeah.
clinics for 20 minutes, and you've got to get a lot into that clinic.
Yeah.
And a big part of our job as nurses when we sit in with our families is the mental health side of things. We want to know about your seizures, yes, we want to know about school, yes, we want to know about life, but ultimately the most that young people bring in is how rubbish they feel sometimes.
Yeah.
And for us to not have that outlet to signpost people to
Yeah.
is, I think, really challenging.
Yeah.
So when we look at the future and we look at hopefully mice and the PAVEs and things coming into, does it still all come down to funding though? Does it still come down to if people are prepared to NHS England to push this out? And
I think honestly it's a bit of both, and I guess as you say, for us, a lot of the epilepsy nurses in some of our sites were telling us exactly that most of their clinic time was spent kind of discussing mental health of patients, mental health and well-being, but they didn't have the kind of evidence-based tools to be able to address that. So for some sites, actually, the epilepsy nurses did have capacity and wanted, I guess it was more kind of a redistribution of their time rather than adding time. Having said that, in other sites, that their kind of epilepsy nurse time is so, limited already that they couldn't do that. And so that's when we needed to bring in other kind of members of the workforce, so child wellbeing practitioners who again are graduate psychologists but are less expensive than someone like a clinical psychologist, but still able to deliver that evidence-based treatment. But to be able to do that and to have those people within the clinic, that does need funding.
Yes, it does, doesn't it? And I think that's what we all come back to money, and it should never really be about that. We're looking at focusing on patient-centered care and what's the best for that individual and what's the best for that family, but often that doesn't really, as much as we want it to be the center, we have to look at what resources we have available to us. And when most of my epilepsy nurse colleagues will tell you quite categorically, our Royal College of Nursing guidance, 250 patients per epilepsy nurse, that doesn't happen, does it, in the real world? So how is the future, Sophie? What would we like to see as the way forward and to help every young person that's diagnosed with epilepsy?
I think we need kind of a suite of interventions. I think all children and young people with epilepsy do need to have their mental health and well-being assessed, screened, so that
at diagnosis, would you say at diagnosis?
At diagnosis and beyond. So I think regularly, that there's no reason that's, obviously diagnosis itself might come with specific areas of need, and potentially that needs researching in its own right in terms of what can we offer at diagnosis. Definitely. And how is that can that support. But we didn't exclude people kind of newly diagnosed in our trial, and we didn't, anecdotally we didn't see any differences between newly diagnosed and not. But I think we also need to be regularly following up with young people to be able to identify the needs, because we know that part of the problem is that epilepsy professionals are maybe not trained to be able to identify those mental health needs. So that would be a start, and then being able to kind of offer this suite of interventions so that we can kind of get the right intervention in at the right time from within the epilepsy clinic.
It looks like it for me feels like it needs like an additional branch adding in, doesn't it? You need your consultant with a special interest or your neurologist. You need that nurse intervention, but you also need this other branch that comes in and goes, actually, we're going to mop up all this really important and valuable mental health support.
To add that expertise into the clinic.
Absolutely. But getting that into the clinic, I think that's a dream.
It's
a dream of when that could actually happen in reality. But I think the work you're doing is invaluable, and I think it will make a massive difference to young people with epilepsy moving forward. Is there any thing that you would want to add to this podcast, to any of our listeners? Are there resources that you would recommend? Is there anything that you would think, actually, this is something I really want to get across to people?
Sure. I mean, Young Epilepsy itself has lots of amazing resources and
Thank
kind
you.
of learning. And we did signpost. So in MICE, we had a group of parents and young people who helped guide us through the whole of the research process, and they recommended various resources that they had kind of accessed that we could signpost families to, and the Young Epilepsy resources were some of those. I think the other thing is to say, yes, in an ideal world, we'd like integrated kind of mental health services within epilepsy clinics, but that shouldn't stop people from accessing evidence-based intervention more generally. So all of the kind of self-help, guided self-help, and CBT parenting interventions that have been developed for children, young people generally, that have a massive evidence base behind them, and can be very effective. There's no reason that those shouldn't be used for children, young people with epilepsy too. And so I guess for people to refer to standard mental health services if needed.
And you can touch base with your own GP and things.
Absolutely, yeah.
So,
I think that's usually where we kind of suggest families kind of go to as their first port of call, is to kind of ask their GP for referrals to either local support services or to mental health services, depending on what the needs are.
Absolutely. And thank you for that, because I think that's really helpful to mention that we do have some really good resources on our website. We have our mental health wellbeing space. We have our Shout service, which is a text service that you can get a response from immediately. Yeah. So we have quite a lot of resources that are available to young people. I really appreciate your time today, Sophie, and thank you for coming out to talk to us about really exciting research and how we can make the future brighter and better for our children and young people. And hopefully we will be able to do that in the not too distant future.
Thank you.
Thank you very much for your time. I would really like to thank my guest for today, Sophie Bennett, our clinical psychologist, for joining me. Her time is invaluable. Her knowledge is amazing, and she's been a great guest for us today. If you are interested in any of the mental health support that we have been discussing here on today's podcast, I know it's vital for a lot of young people, please do click on the link below. There are so many resources available from Young Epilepsy that are there to help and support not only families, but healthcare professionals as well. So please like and follow us on our socials.
Together we create possible.